Hey folks, Professor Finn here, and today we're going to resume our study of pathology for mortuary science students by looking at the next chapter. So before we get into that, as always, like, share, subscribe, share this video and this playlist with a friend, let them know it exists, and let's talk about diseases of the female reproductive system. So pelvic inflammatory disease, or salpingitis, the infection and inflammation of the female upper genital tract, especially the fallopian tubes. It lacks a specific definition. So pelvic inflammatory disease lacks a specific definition, but includes endometritis, which is the inflammation, infection of the endometrium, salpingitis, inflammation of the fallopian tubes, and oophouritis, which is inflammation and infection of the ovaries. Myometritis, inflammation, infection of the uterine wall. Parametritis, inflammation, infection of the uterine serosa and broad ligaments. Vaginitis, inflammation, infection of the vagina. And endocervicitis, which is the inflammation of the lining of the uterus due to bacterial infection. There are two stages to pelvic inflammatory disease. You have vaginal and cervical infection, and finally, the infection spreads to the upper genital tract. Signs and symptoms of PID are usually lower back pain, although it is also asymptomatic. You might not even know that you have it. Venereal disease, or sexually transmitted disease, abbreviated by the letters STD, is the most common infectious disease in the United States. What are causes of STDs? Well, we have AIDS, chlamydia, genital herpes, genital warts, gonorrhea, syphilis. Lots of common things out there that probably many of you have been taught to guard against since high school, if not earlier. So what are signs and symptoms of STDs? STDs often have identifiable lesions, but many do not, which is why it is spread so easily. Ectopic pregnancy, or tubal pregnancy, is an implantation of the fertilized ovum in a site other than the normal one in the uterine cavity. Usually, the implantation occurs in the fallopian tube, although it may implant in the ovary, abdomen, or cervix. And sometimes this is idiopathic. What are some causes of ectopic pregnancy? Obstruction of the passage of the fertilized egg through the fallopian tubes to the uterus due to physical blockage in the tube, or failure of the tubal epithelium to move the fertilized egg down the tube and into the uterus. Previous tubal infection or surgery might also have caused scarring of the lining of the tube, which can inhibit the passage of the fertilized egg. Complications as a result of ectopic pregnancy usually include salpingitis. So if you have a history of tubal pregnancy, this usually correlates with a history of pelvic inflammatory disease, and unfortunately, ectopic pregnancy rarely progresses to full term. Preeclampsia and eclampsia. So preeclampsia is a blood condition that happens during pregnancy characterized by high blood pressure, weight gain, and protein in the urine. Eclampsia is the occurrence of seizures during pregnancy which cannot be attributed to another cause after the 20th week of gestation. Both are idiopathic. We do not know why they happen. At risk are first-time pregnancies, teenage pregnancies, mothers older than 40, African American women, multiple pregnancies, history of diabetes, hypertension, or renal disease. Signs and symptoms of preeclampsia include swelling of hands and face on arising to begin your day, sudden weight gain over 1 or 2 days, persistent headache, and upper abdominal pain. With eclampsia, you have signs and symptoms of seizures, severe agitation, periods of unconsciousness, aches and pains after seizures. Treatments? Well, deliver the fetus as quickly and as safely as possible. The sooner the baby gets born, the quicker this will end. Medications can be used to control elevated blood pressure and seizures. And finally, bed rest. Endometriosis. This is a condition in which the tissues that normally line the uterus, which is known as the endometrium, grows in other areas of the body, such as the pelvic area, surface of the uterus, ovaries, intestines, rectum, or bladder. It is idiopathic. Endometrial cells outside the uterus respond to the body's hormonal activation and cannot separate from the tissues around them. What are signs and symptoms of endometriosis? Pain, irregular bleeding, increasingly painful menstruation, abdominal pelvic pain and cramps lasting for a week surrounding menstruation, pain during or following sexual intercourse, premenstrual spotting of blood, and infertility. Complications of endometriosis, again, can include infertility, scarring of tissues, and occlusion or blocking of the fallopian tubes. Ovarian cysts are sacs filled with fluid that develop on or within the ovary. A functional cyst is one that is not caused by disease. The cyst forms in the days preceding ovulation when a follicle grows but fails to rupture and release an egg as it should. Does not have to be removed by surgery like a tumor. Fluid is not reabsorbed and the cyst disappears after about 60 days. An ovarian blood cyst, also known as an endometrioma or chocolate cyst, is a form of endometriosis and can grow to be about the size of an orange. A dermoid cyst is a tumor covered in dermis-like tissue that contains sebaceous glands, hair, cartilage, bone-like structures, nails, or teeth. Can occur anywhere in both males and females, and a cystic teratoma can specifically occur in the ovary. Signs and symptoms of ovarian cysts include constant, dull, aching pelvic pain, pain during intercourse or normal movement, pelvic pain shortly after beginning or ending of menses, changes in the normal pattern of menstrual bleeding, lengthened or shortened menstrual cycle, absence of menstruation, or abdominal bloating or distension. Typically, functional cysts disappear on their own. Cervical cancer. There are two primary categories. You have squamous cell carcinoma, which is the most common, and these are the cells on the surface of the cervix atop the vagina. You also have adenocarcinoma, which are glandular cells lining the cervical canal. The best way to detect precancerous or cancerous cells is through a pap smear or a cervical smear. Signs and symptoms of cervical cancer can include abnormal bleeding between periods or after sexual intercourse, malodorous vaginal discharge, or discomfort during intercourse. Breast cancer. Exact causes of breast cancer are unknown, but risk increases with age. It is uncommon under the age of 35, more frequently occurs over 50, and Caucasians are more at risk. Signs and symptoms of breast cancer, well, in early stages it is asymptomatic with no signs or symptoms. Lump or thickening in or near the breast or in an underarm area. A change in the size or shape of the breast. Nipple discharge or tenderness. The nipple is pulled back or inverted into the breast. Ridges or pitting of the breast. And breast areola or nipple may be warm, swollen, red, or scaly. Treatments for breast cancer include fine needle aspiration. A fine needle aspiration involves a small needle which removes some fluid and some cells. They have to test it via biopsy, so they're going to take cells to try to determine what it actually is. You have needle biopsy, which is a larger needle, which removes more tissue and fluid. And finally, you have a lumpectomy, which is the surgical excision of the lump and some healthy tissue surrounding it. Treatment for breast cancer can include mastectomy, which is a complete removal of a portion or whole breast. There are 4 non-cosmetic disadvantages to this. There is the psychological distress of the alteration of the body, the invasiveness of the procedure, especially in full removal, the degree of anesthesia required, recovery time, and the necessity of physical therapy. So the types of mastectomy are subcutaneous, which is the removal of entire breast leaving the nipple and the areola. A total or simple mastectomy, which is the removal of the entire breast but not the axillary lymph nodes. You have a modified radical, which is the removal of the entire breast and most of the axillary lymph nodes. And finally, a radical, which is the removal of the pectoralis muscles, breast, and axillary lymph nodes. This was once the standard treatment, but in modern medicine, it is rarely used because of the damage it causes to the body. So in basically order of progression, The subcutaneous is the least invasive. It then goes into a simple or total mastectomy, a modified radical, and finally, radical mastectomy. So, what are the conditions of significance involving diseases of the female reproductive system? Well, rapid blood coagulation, which can cause clotting issues. So you're going to want to monitor your distribution. You're going to want to start at low injection flows and then build into higher once you have established distribution. You may have ascites, generalized edema, which, if you have generalized edema, this may alter the type of fluids and co-injections you use. Edema, pitting or firm edema. So again, try to resolve this with type of co-injections as well as stronger than average fluids. Infections, which lead to stronger than average fluids because you'll have extra material that you will need to deactivate. And discolorations, so you may run the risk of formaldehyde gray, things of that nature. So this is going to come down to your skill as an embalmer in controlling all the different variables that you should be very comfortable with by the time that you are a professional embalmer. This concludes this lecture. We will see you next video. Don't forget to like, share, subscribe, and share this with a friend. And we will see you next lecture.